Hello, I'm Dr. Luna. On this channel, we talk about real health, clear medical advice, and smart prevention, especially for those in the most wise and experienced stage of life. If you care about your well-being, or that of someone you love, this is your place. Let's begin. I'm Dr. Luna, and today I want to speak directly to you, or someone you care about, who is over 60. Did you know that many older adults ignore warning signs that could potentially save their lives? Today, I'm going to reveal 5 silent symptoms that, although they may seem minor, could be the beginning of something serious. This isn't to scare you, it's to help you act in time. Stay with me until the end, because number 5 is the most common and the most ignored. As time goes on, our bodies change, and these changes aren't always easy to notice. Many older adults think that feeling tired, confused, or in frequent pain is just a normal part of aging. But that's not always true. Sometimes, those small symptoms are hiding something more serious. The real concern is that these signs are often ignored or minimized until it's too late. That's why I want you to pay attention today. The signs I'm going to share may seem normal, but they're not. Recognizing them early can make the difference between a healthy life and a serious complication. And the best part, you don't need to be a doctor to detect them. You just need to observe, listen to your body, and above all, not be afraid to take action. Because in health, prevention isn't just important, it's vital. 1. Extreme fatigue without a clear cause. This isn't just about feeling tired after walking or exercising. It's about a deep exhaustion, even after resting or right after waking up in the morning. Many people blame age, but in truth, this could signal something more serious. Heart problems, anemia, sleep disorders, or even depression. The problem is this fatigue becomes part of daily life, and no one questions it. If someone who used to be active now avoids activities, sleeps more than usual, or simply says, "I just don't have energy," don't ignore it. Our bodies speak to us, but we need to learn to listen. Persistent fatigue isn't normal. If it lasts more than a week or 2, it's time to consult a doctor. Catching it early can prevent serious complications and improve quality of life. Sometimes a simple blood test can provide answers and prevent much worse. 2. Sudden memory loss or mild confusion. This isn't about forgetting where you left your keys once. It's about frequent changes like not remembering close people's names, repeating questions, or getting lost in familiar places. Families often say, "It's normal, they're just getting older." But it's not always that simple. These could be early signs of cognitive decline or the start of Alzheimer's disease. Ignoring them delays diagnosis and treatment, and the earlier these mental changes are detected, the better the chance to intervene. Changes in lifestyle, improved diet, brain exercises, or adjusting medication can make a big difference. Memory is part of our identity. Taking care of it is part of taking care of our health. 3. Loss of balance or frequent falls. If an older adult often trips, feels unstable while walking, or avoids movement out of fear of falling, it's time to pay attention. Falling isn't just a natural part of aging, it could be a sign of deeper issues. Muscle weakness, medication side effects, neurological problems, or even vision issues. Falls in older adults are not minor accidents. They can cause fractures, loss of independence, and serious health consequences. If someone has fallen more than once in recent months, don't ignore it. Check their environment, their shoes, their physical strength, and current medications. Gentle exercises like Tai Chi or physical therapy can greatly improve balance. Preventing a fall isn't just avoiding an accident, it's protecting years of healthy and active life. 4. Loss of appetite or sudden changes in eating habits. If an older person stops eating like they used to, loses weight without explanation, or shows little interest in food, don't overlook it. It might seem like nothing, but it could be linked to digestive issues, metabolic diseases, depression, or even cancer. Poor nutrition in older adults can cause nutritional deficiencies, muscle weakness, weakened immunity, and increased risk of infections. Often, they say things like, "I'm not hungry," or "just a little is enough." But the body needs essential nutrients, especially in this stage of life. If someone stops eating, avoids foods they once liked, or loses visible weight, seek medical help. Sometimes it's a matter of adjusting their diet, changing food textures, or presentation. Other times, it's a sign of something more serious. Listening to the body also means noticing what it no longer asks for. 5. Mood or personality changes. This is one of the most common and most ignored symptoms. If a senior who used to be cheerful, active, and sociable suddenly becomes irritable, apathetic, or even aggressive without reason, it's important to take notice. These changes aren't always just old age. They could be signs of depression, anxiety, hormonal imbalance, or even neurological issues. It's easy to assume that sadness or moodiness is normal in old age, but it doesn't have to be. Emotional health is just as important as physical health. If someone becomes quiet, loses interest in their usual activities, or reacts unusually to everyday situations, don't dismiss it. Speaking to a professional can help identify the cause and offer real support. Early intervention can improve mood, life quality, and even family relationships. Aging with dignity also means feeling good on the inside. Now that you know the 5 warning signs that should not be ignored in older adults, remember that early attention and prevention are your best tools. Extreme fatigue, memory problems, loss of balance, appetite changes, and mood shifts may seem small, but could signal something that needs medical attention. So, pay close attention and don't hesitate to seek help. Healthy habits like balanced eating, light exercise, and keeping the mind active can make a big difference. Remember, well-being includes caring for both body and mind. Small daily actions, like walking, socializing, and regular checkups, are keys to a long, healthy life. Never ignore what your body is trying to tell you. Recognizing these signs early can not only improve life, it can save it. You're not alone in this journey, and acting with knowledge and prevention is always the best path. Stay alert, care for yourself and your loved ones, and join me for more tips to live a full and healthy life. Think about your parents, grandparents, or that older person you love. They've lived so much, gained wisdom, and now face challenges that often go unnoticed. Health in old age isn't just about treating illness, it's about protecting their quality of life. These 5 signs aren't just medical data, they're calls to be present, to care, and to act with love and responsibility. Imagine being able to detect a problem in time and help avoid suffering or serious complications. That's real care. It's not about fear, it's about commitment. Every gesture, every bit of attention can make a difference in the lives of those who've given us so much. Caring for the health of older adults means caring for our history, our families, and our future. Stay informed. Share this knowledge. Together, we can create a healthier, happier environment for all.